Hey everyone, it's Anne Sinclair from Digestive Detective. Thanks for tuning in again today. Yesterday we looked at what diverticulitis is and what some of the risk factors are. Today I'm going to talk about knowing if you have diverticular disease, what are the signs and symptoms, and how you can get a clear diagnosis and be able to start treatment. So the pre-diverticulitis condition is called diverticulosis. Hard to get your mouth around those. So, which is the initial herniation of or outpouching of the bowel. Basically, it's generally asymptomatic for most people. It's when that we move into the more impacted, inflamed, infected state where you see signs and symptoms. Now, remember, with signs and symptoms, signs are basically objective things that we can feel in ourselves, whereas symptoms are a trait of the disease. So symptoms are what the person's experiencing. They tell what they have. For example, a symptom, a fever is a sign, but feeling like somebody's poking you with a hot stick is a symptom, yeah? So signs of diverticulitis are excessive gas, blood or mucus in the stool, fever, a change in bowel habits. So you could be either constipated or have diarrhea, but the key is here, it's different to your normal bowel habit. Abscesses, fistulas, bowel obstructions and perforations, while you can't see these things, they can be detected once you have medical investigations. So symptoms of diverticulitis: abdominal pain, biggie, usually on the left side, nauseousness, and lack of appetite are also ones. So, and also bear in mind that these signs and symptoms are indicative of many conditions. You know, IBS, Crohn's disease, ulcerative colitis, they all have similar signs and symptoms in those conditions. So one of the key things to mention is that for the signs and symptoms, is it a change for you? Has something changed for you? That's a really big thing to think about. So how do we, hi Narelle, how do we recognize, how do we go from recognizing signs and symptoms and making an accurate diagnosis? There are some blood tests that you can do, generally to identify inflammation and infection. So your doctor will be able to do these. So some of the things are white blood cells, will help illustrate if you have any infections. Red blood cells and iron studies will help you explain any unidentified bleeding going on in the gut. ESR and CRP, they're both inflammation markers, so they will show if there's a level of inflammation in the body. So these blood tests, while they are useful identifying that there's a problem, it can't necessarily tell you what the problem is. So to confirm the presence of diverticulosis, then the outpouches, a visual investigation needs to happen. So there's some of the investigations that you have can be more invasive than others. So there's a couple. Barium enema, which is not really popular very much anymore, not as invasive as some of the rest of them. Ultrasound, CT scan and colonoscopy. Most people go for the colonoscopy to see if they have diverticulosis or diverticulitis. Most people are told, you know, at the end of their colonoscopy, oh, you have diverticulosis, and then sort of left to go on their merry way and never thought about again. So after all of this, being diagnosed with diverticulitis, where do you go from there? What do you do? Tomorrow I'm going to look at the dietary considerations in the management of this condition. So if you're ready to start the healing process with diverticulitis disease, why don't you jump onto my website and book in for initial consultation, or just book in for a free 15-minute and we can walk you through some steps that are really good. Tomorrow we're going to do foods, and then Thursday we're going to do a case study of a case that I've seen, and I've seen a couple of cases of this, but some are really worth talking about, and then I'll see you then. So I will post today a blog post about diverticulitis, so I look forward to, so if you want to skip ahead, you can pop ahead and read that. So I look forward to catching up with you tomorrow. Have a great day, everyone. Bye.